Good morning, everybody. Can I firstly thank the nearly 84,000 people that came forward to testing in the last 24 hours. That is the highest number New South Wales has ever had in a single day. And I especially want to thank the community of Fairfield for coming out in large numbers, but also to everybody who put themselves forward for testing. This is a great result and one that we need to keep up during the next few weeks to make sure we capture all the cases that are out in the community. As a result of this record testing, we did have 110 cases to 8 p.m. yesterday. That is a high number, but a number which reflects the high amount of testing that we had. What is concerning, however, that 43 people in those number of cases were infectious in the community. Now, I want to stress that you might not have any symptoms and not know you have the virus and still be infectious. Those 43 people haven't necessarily done the wrong thing. But what it does show is how infectious and contagious the virus is. So it means that every time you have contact with another human being, you risk either getting the virus or passing the virus on. You might not even have any symptoms, but yet that is what is causing the virus to spread. And I want to thank the people of Fairfield local government area, in particular all the suburbs that are in that local government area, for coming forward and getting tested. And we've seen the cases in that local government area, whilst they remain consistently high compared to the rest of the state, we're now seeing additional spillover in the Canterbury Bankstown local government area and the suburbs within that area. Dr. Jeremy McAnulty will read out the suburbs of concern in Western Sydney, and we need to make sure that we have those high rates of testing and that limited mobility in those areas as well. But the simple message is, please do not leave your home unless you have to. If you have to leave your home for work, make sure that you're following the strict COVID safety plans around your workplace. Workplace colleagues, unfortunately, are the highest likelihood of transferring or getting the virus, and then, of course, people taking it back to their households. Please know how extra careful everybody needs to be, because the last thing anybody wants is unknowingly taking the virus home and giving it to your loved ones, because we know the chances of every single person in the household getting the virus are very, very high. Had we not gone into the lockdown a few weeks ago, the 110 number today would undoubtedly have been thousands and thousands. There is no doubt about that. So we've been extremely successful in limiting the spread to what we have today. But we need to work harder. And of course, all of us need to be on guard every time you leave your home. Please assume you have the virus or somebody else has the virus. If you're going shopping, as difficult as it is, do not engage, do not talk, get in, get what you need, come home. If you're going to work, please have as little interaction as possible. The simple message is we need everybody to stay home unless you have to go outside. And when you do, please have limited conversation, limited interaction. Of course, some people still need to continue to work to keep all of us going. But even then, please make sure that when you interact in your workplace, that it's limited. What we don't want to see is further spreading of the virus into other parts of Greater Sydney and, of course, as we've seen in the regions. Today, the Deputy Premier will talk about regional New South Wales. Minister Dominello will talk about Service New South Wales and the good work they've done in supporting businesses and families to get through these difficult times. So the simple message is, this is really serious. We have done well to stem the growth that other countries around the world have seen with the Delta strain. We've stopped the thousands and thousands of cases that other countries around the world have had. Our vaccination rates are so low, and yet we've done really well in stemming the growth of the virus. What we need to do now is quash it, because with the vaccination rates the way they are, we won't be able to live freely and safely unless we're able to quash this current outbreak. And that's why I just ask everybody to continue to do what you're doing. Don't leave home unless you absolutely have to. And please know that you might be doing the right thing, but you might still unintentionally give the virus to someone else or get the virus from someone and not know it, and then go home and infect those that you love the most. That's why we're just asking everybody, please be careful, please don't cut corners. If you need financial assistance, don't be embarrassed, because we are here to support you. We fought hard for that financial support, and the New South Wales government has put in an extra $4 billion to make sure we support our businesses and our individuals and families. So I just want to again thank everybody for your efforts. I know that some people are very upset and angry and frustrated. We all are. But the measures we're putting in place have stemmed the growth of the virus, have allowed us to go into a phase now where we want to quash this thing. And I just want to thank every single person that came forward to get tested. That 84,000 number is really, really encouraging. It means we're scooping up, as Dr. Chant said a few days ago, we're scooping up all the cases we can find, and we're making sure we get to those chains of community transmission. So thank you again. Please keep going, and know that I'm absolutely confident that we will see through this, that we will make sure we get to live as freely and as safely as we can, but we just need everybody to take it seriously. And we know some businesses in particular are very upset, but know that we wouldn't have taken the decisions we did unless we absolutely had to, because safety at this stage of the pandemic is key, and that will give us economic freedom down the track. But what we need to focus on now is stopping the spread, quashing the virus, so that we can live freely and safely moving forward. Now Dr. McAnulty will give the health update. The Deputy Premier will say a few words, Minister Dominello will say a few words, and then we'll take your questions. Thank you.
Thanks very much, Premier, and good morning. As the Premier mentioned, overnight we recorded 110 locally acquired cases of COVID in New South Wales at 8 o'clock last night. 54 of these were linked to known cases or clusters. There were 2 new cases in overseas returned travellers in hotel quarantine. There have now been 1,528 cases associated with this outbreak, and 83,477 tests were done, which is a fantastic level of community testing. In terms of isolation, of the 110 cases today, 37 were in isolation throughout their infectious period, 17 were in isolation for part of their infectious period, and 43 were infectious in the community, 13 we're still investigating. There are a number of areas of concern, so we've seen this focus of cases initially in southeast Sydney, then southwest Sydney. We're now seeing cases in western Sydney increase. So we're concerned about the following areas. People should be particularly vigilant and don't hesitate to come forward for testing at the slightest symptom. Cumberland, particularly Marylands in Guildford, Belrose, Toongabbie, Seven Hills, Mount Druitt, Rudy Hill, Lakemba, Fairfield, Haymarket and Wollongong. So if you have any of the slightest symptoms, or if your friends or family do, nudge them along to get tested right away. We have introduced from Friday increased testing for people from the Canterbury Bankstown LGA who work in healthcare or aged care facilities. From Friday the 23rd of July, a person who lives in Canterbury Bankstown LGA who engages in aged care or healthcare can only work outside of the Canterbury Bankstown LGA if the person has been tested for COVID-19 in the previous 72 hours. In terms of hospitalisations, there are currently 106 people with COVID admitted to hospital in New South Wales. 23 are in intensive care and 11 require ventilation, which just shows how serious this disease can be for some people. In terms of the orange area, a positive person unknowingly who had COVID had travelled from Sydney to Blaney for authorised work, completing 4 overnight trips from Western Sydney to Blaney between the 13th and 17th of July while potentially infectious. A close contact from the Nestlé Purina pet care factory since tested positive to COVID-19, and as a result all other staff at the factory being tested are in isolation. Other drivers who have transported goods to and from the factory between 4 p.m. Thursday the 15th and 6 a.m. Friday the 16th of July and 4 p.m. Friday the 16th of July to 6 a.m. Saturday the 17th of July are also being identified and asked to get tested and to isolate. And the factory is being closed. The person, while unknowingly infectious, had been in Orange on Saturday, morning and afternoon, and there are a number of locations in Orange that we're concerned about that we've called out for people to come forward for testing and isolation if they've been there. Thank you very much.
Well, good morning. As we all know, overnight, on the advice of course, New South Wales Health, the New South Wales Government made a decision for the first time to act fast, hard and local, and lock down 3 local government areas in regional and rural New South Wales. The local government areas of Cabonne, Blaney and Orange, as of today, or as of midnight last night, have had a series of stay-home orders that apply. Those stay-home orders are that you can't leave home unless for work or education, for medical or care, of course for shopping, for groceries or for goods and services, and for exercise. We also accept that hospitality will now close unless offering takeaway. And this decision was made to make sure we protect those communities. The Central West is an intertwined region, and especially areas of Molong, Blaney and Orange. Of course, those communities come together often, and that those communities of interest are one that we are well versed on. The decision was the right decision to make sure that we don't overwhelm the health system, and off the back of the health advice, we've made that decision today. It's a reminder to everybody that we in regional and rural New South Wales aren't somehow not going to be impacted by the current Delta strain. We know it's infectious, we know it's transmissible, and we know how contagious it is. And this decision was a decision made on behalf of the citizens of the regions. Can I say thank you to the mayors, the local members that engaged with us and joined us last night when this decision was made, and of course as community leaders now being the voice to make sure that we follow the rules for the next 7 days. This is also a reminder that in regional rural New South Wales we continue to should focus on getting our vaccination rates up as well, and of course Health Today will be standing up right across those regions more testing clinics. If you're not feeling well in regional rural New South Wales, if you're not feeling well in those local government areas, please go and get tested, because what we don't want is to have the unknown of how many cases we have in the community. I have all confidence with the decisions that we've made overnight and with the citizens of the regions and those communities that together we will beat this issue and come out of lockdown in 7 days. But we will continue to keep the community up to date. And again, to the community, please get tested if you're not feeling well.
Good morning. As you know, we've negotiated with the federal government to make sure that for individuals that require support, you can go to Services Australia. For businesses that require support in New South Wales, please go to Service New South Wales. As of 11 o'clock this morning, we've received 15,500 applications. We've processed $196 million worth of those applications, and as of yesterday, $26 million has already hit the bank accounts, with more coming. We're trying to turn these grant applications around as fast as we can to make sure we get businesses the money as quickly as possible. If there's any concerns at all, please contact Service New South Wales 137788. They are there to support and help you throughout this time. Thank you.
Lockdown is not reducing the number of infectious numbers in the community. If that's not working, what is the next step?
As the health experts have said, we obviously went into harsher conditions last Friday, and we won't have a sense until this weekend and early next week what the result of those harsher restrictions have been. And I just ask for everybody's patience. But please know that what we have prevented here in New South Wales is what we've seen around the world. In many jurisdictions, even when they've had much higher vaccination rates than New South Wales, they're recording thousands and thousands of cases a day. We have done incredibly well in keeping the numbers where they are, but we need to do better in order to live more freely, and that's why we're just asking everybody to please respect the rules in place. We know many businesses that hadn't been impacted in the last 18 months are now impacted, and that's because this Delta strain is much more contagious, and it's a cruel disease where any form of human interaction, any form of human interaction is causing transmission. And that is a very different situation we have now than what we had in previous strains, and that's why we've had to take the action we have. I just appeal to everybody's patience and calm. We will get through this so long as people take it seriously, and sometimes people, through no fault of their own, they don't even have symptoms, are carrying the disease and giving it to others unknowingly, and that's why all of us have to be on guard. That's why the government has made some difficult decisions based on the health advice, and I just say to everybody, we will get there. I'm absolutely convinced of that.
Are you considering locking down harder, or is this it? Is this as hard as New South Wales goes? And if that's the case, is there a plan B with some restrictions and the virus bubbling along until vaccination?
Look, it's really important for us not to talk about what might happen. We need to really assess the health advice and the data that we get for the next few days. And once that data comes through, once the number of cases and how they're transmitting comes through over the weekend and early next week, we'll have a better sense of what July 31 looks like. And as soon as the government knows, we will of course convey that. But I want to say New South Wales has put in some pretty tough restrictions, tougher than we've ever gone, tougher than some other states have ever gone. And that's because it's really important for us to quash this virus, whilst unfortunately our vaccination rates remain where they are. And I also want to make this point, that we do need to give the extra restrictions a chance to do the job they need to do. And I just appeal to everybody. I know that a lot of businesses who previously were allowed to conduct their business have now been asked not to do so. There's a reason for that. Every time two human beings come into contact, if they're not in the same household, so if you come into contact with someone who's not regarded as in your household, there is a big threat, a big risk that you will either give them the virus or get the virus, and you might not even know. You might not even have symptoms, because what we're finding with the Delta strain is that the infectiousness is kicking in much earlier, and that it's you're more infectious early on than you were in previous strains.
Premier, are we still working towards having 0 people infectious in the community? And do you think that is one that we can achieve that, or 2, is it just going to take too long? It might take months.
No, if we work together, our target always is, today I spoke about that 43 number being infectious in the community. That's the number we would like to see at 0 or close to 0. And that will be based on the health advice. If that number is in settings which are low risk, well, obviously we can ease restrictions. So it's really based on the health advice, and it really depends on where those infections took place. So please know that we're analysing all that data on a daily basis, but we won't know the effect of those harsher, very harsh restrictions we put in place last Friday until around the weekend or early next week. Who hasn't asked a question? Sorry. Yeah.
Your vaccination target is 80% of animals. How long will it take us, based on the current vaccine rates, to get to 80%? And is that our freedom day? Is that the day we're going to live without them?
Look, our freedom days, when we get really in terms of the Delta strain, is we will be easing restrictions as we can, as soon as those infectious rates come down. But in truth, we won't live as freely as we need to or we would like until those vaccination rates increase. Now, that is one thing the New South Wales government can't control. We can't control the doses we get, but what I can assure you is as soon as we get those doses, they will be going into arms. Oh, sorry, follow up. Yeah. I'll get to everybody, don't worry.
Do we have a date, or do we have around about how many weeks it's going to take us to get to the target that you've set?
Well, look, obviously we are guided by the health advice, and given what the Delta strain is doing in relation to our vaccination rates, the federal government has told us that from mid-September to the end of October we will get many more doses, and we're looking forward to that. That's why we've opened up all of our vaccination hubs, both in the cities but also in the rural and regional communities. We've got the pharmacists on board. We're supporting the GPs in raising issues they have with the Commonwealth. So we're doing everything we can to be ready when we get those extra doses. But what is both the challenge and the opportunity for us is to quash as much of this Delta strain now so that we can live as freely as we can during those months until we get those vaccination rates up. And I don't know how many times I've spoken about a sense of urgency with vaccinations. I've gone blue in the face from ages ago about how important it was for us to get those vaccines, and that stands the case. Please follow the health advice. If you're over 60, you should have the AstraZeneca. If you're over 40, get advice from your GP or health professional, because the New South Wales hubs can deliver you AstraZeneca as well. And of course, we have the opportunity to get those vaccination rates up, but really we're waiting on those extra doses to get those vaccination rates up.
Jeremy, you said when construction is poised to come back, when are you going to say the same thing for, say, schools and outline a path out of lockdown?
Well, obviously we'll be able to do that as soon as we have a sense in the next week of what the impact of those very harsh restrictions have had on the community. And this disease is cruel, and it's most cruel because the Delta strain spreads when two human beings come together. So the cruelty of this disease is human interaction, and that's why some industries are much more impacted than others. Those who are able to work at home obviously have an advantage because they're in types of work which don't rely on human interaction. But what we know is that any form of human interaction is spreading the disease, and that's why we just need to stop that human interaction. And some industries you're able to control that more than others, which is why we'll be able to give a clear path and a clear message to the community. But I think the vast majority of our citizens understand how important it is for all of us to play our part. There is support and assistance there for anybody who needs it, and please know that mobility is what we need to stop. We just need to stop people leaving their home unless they absolutely have to, and when you have to, please get in and out quickly. Don't linger, don't talk to people, just be very serious and organised in what you're doing and come back to your safe household.
Infectious disease experts say that the zero target in the cases...
I'm sorry, I didn't hear the first part of the question.
Infectious disease experts say that a zero target for the community cases is not feasible at this point. Do we need to change that target? And also, why are we still seeing so many people out in the community while infectious? Do they not understand what that means and what being infectious in the community actually is?
Firstly, the New South Wales government relies on the best health advice we have, and I believe we have the best experts in Australia and arguably around the world working with us. So we will rely on the health advice as to when it's safe to ease restrictions, and we're looking forward to considering those opportunities early next week when we get some more solid data on the impact of the harsher restrictions we put in on Friday. So that is the first issue. The second issue is this is a cruel disease. You might be doing the right thing 24/7 but unintentionally get the disease from someone else, or unintentionally be a carrier and not know it. That is the cruelty of this disease. You might be doing everything right. That's why we had to take those difficult decisions about limiting interaction, especially at workplaces, because what workplaces do are bring in people from different suburbs and different areas. So what we need to stop is having this disease creep into different parts of Greater Sydney and of course in the regions. This is a cruel disease, and that's why we've had to be extra tough in the way that we deal with it. But if we stick to the course, if we follow the rules we have in place, if we reduce our mobility and make sure, as hard as it is, the harder we work now, the less time we'll have to stay with the current restrictions in place.
Melbourne modelling is putting us not coming out of this until September at the earliest. Firstly, they've run this, they say, 10,000 times in all of the different scenarios, and that's as good as it's going to get for us. Do you agree with that modelling, and do you have your own modelling, and what does it say?
Look, can I say that we see versions of lots of different modelling. Remember the modelling we were presented with 18 months ago about the number of cases and deaths that would happen in Australia, which didn't materialise. So modelling has a role and a purpose. But what is the most effective tool for us to measure what the future looks like is the result of our own activity. The modelling can't predict how many people are going to stay in their homes and not be mobile. The modelling is just an indicator for what could happen, and different modelling gives you different results. What we need to do and what we need to rely on is our own actions, because that is what will determine the outcome. We've seen lots of modelling before which hasn't happened, which hasn't come to fruition. Modelling is an important tool, an important guide, and for every model there'll be a different and opposite model. But what we know, what the best health advice tells us, is we need to reduce mobility, reduce interaction with others, especially in workplaces. especially in workplaces and especially when we're out doing important things like getting groceries or getting important food or important services. That is when we need to reduce our interaction, and that is why Dr. Chan and Dr. McAnulty day after day say to us, if there's anything you can put off in the next few weeks, put it off. If you don't have to leave the house, please don't. We've put emergency measures in place, such as being able to go out and exercise to make sure people can uptake their mental health and have that limited interaction if you live by yourself. But please know we've kept that opportunity there so that people have that outlet. But aside from that, we just need everybody to please appreciate, and I know the community does, everybody appreciates how serious this is, but I hope everybody also reflects this is why the government took those difficult decisions we did.
AstraZeneca to under 40s. Is it time to get AstraZeneca to under 40s? Is it time to forget about the ATAGI advice? And is it time to get hubs into Fairfield, vaccinations into Fairfield?
Well, we already have, yeah. Can I say to the community, New South Wales Health has already responded. We have a vaccination hub in Fairfield where we're obviously already targeting particular groups of workers and groups of individuals. But what we don't have at the moment is those doses. So we appreciate the health advice that exists around AstraZeneca. We've even said to young people, if you do want the shot, go get your health advice, and you're able to get the shot at any age. But you have to assess, obviously, based on the health advice, your own conditions. But can I please make this point? New South Wales is up and running and ready to get those jabs into arms. What we do need are the doses.
Gave us 150,000 extra AstraZeneca doses. Have they been administered? That's one probably for Minister Hazzard.
Look, can I say that we provide a daily update of the doses that are administered. We're running at about 300,000 a week in New South Wales. We're providing, but we don't have all the doses. We can actually do more, but we have around the capacity, just New South Wales alone, to do at least 3,000 jabs a week. But unfortunately, we don't have that many Pfizer vaccines to be able to meet that demand. AstraZeneca is around, so if you're over 60, you should get AstraZeneca. If you're over 40, it's available in our New South Wales hubs if your general practitioner or your health advice says you can. And obviously for younger people, if they want the AstraZeneca jab, check with a health expert and they'll be able to get that.
Sorry, Minister Hazzard, no, we didn't get an answer to that. Minister Hazzard, what's happened? Have those 150,000 extra AstraZeneca doses that the federal government gave us for South West Sydney gone into arms?
And one point I'll make on that before I give Minister Hazzard the call is they were just doses brought forward. They're not extra doses. So please be clear. Please hold on. Yeah, please be clear. I just said we're doing about 300,000 a week, and we have the capacity to do more. But if you want Minister Hazzard to repeat what I've said, I'm happy for that to happen.
Minister Hazzard, have the doses that the federal government brought forward gone into arms?
Yeah, each time I hear that, I'll be careful what I say. Look, the big issue is there's plenty of AstraZeneca around. That's not the issue, it's the Pfizer. And AstraZeneca is principally obviously being delivered through GPs. And the GPs have not been, there are not enough GPs to actually give the AstraZeneca. So the net result is we're encouraging the federal government to get the GPs. I mean, obviously, if you're taking AstraZeneca, because of some of the issues that have been raised by the federal government, there has been a degree of reluctance in some communities. But it's fair to say that there is plenty of AstraZeneca around both for GPs and for our state hubs. But our state hubs, let's not forget that the state hubs were set up to backfill and to fill in because the federal government wasn't actually getting enough vaccine out through the GPs. So we've done all that. The New South Wales government, and I've got to thank again the medical staff, the nurses, the doctors who are at these hubs. They are ready to go with anybody who comes through those hubs, and we can certainly provide more AstraZeneca. I would like to take the opportunity, though, just to raise one issue, and that is, in terms of hesitancy around vaccine, I want to remind people that if you're over 60, if you get COVID, you have a 1 in 200 chance of dying. If you're over 50, you have a 1 in 500 chance of dying if you got the COVID virus. But in terms of the broader issue, it is far more effective that you would have the vaccines and make sure that you avoid those risks. Because if you have the vaccine, you have a 1 in 2 million chance of actually dying. So the odds are with you. You know, you could take a bet on Tab and you'd be doing far better if you'd had the vaccine. Sorry, I enjoy your enthusiasm, but not that quickly and when it's so cold.
Victoria has
I'll go to Liz first.
400,000 AstraZeneca vaccines. We've done 100,000.
I'll come back to you on that, but I tell you that we have actually done as much as is humanly possible. The issue is we need more vaccine. We need more Pfizer. And they're not. No, they're not. No, they're not. No, they're not. They're rolling. As the Premier just said, I'm sorry, you're wrong. What has happened is they've advanced some, and those vaccines are going out. We can't get enough Pfizer to actually fill up all the facilities we've done. Lucy, sorry, James, Lucy.
Minister Hazzard, the Macquarie Fields Vaccination Centre is due to open in less than a week. That's on Monday.
Sorry, which one, Lucy?
Macquarie Fields.
Oh, yeah. Yep.
And people in the community out there say they're still unable to book. Bookings aren't open. They're wondering when they can get in. Is that going to open on time? And are people going to be able to get jabs?
Yeah, the expectation is that it will open on time, and we're obviously doing all the necessary software to make sure it'll be available very soon. Yeah. Sorry, could I just do James and come back? Sorry.
Minister Hazzard, the Premier said that workplace colleagues are unfortunately the highest likelihood of transmitting the virus. But since the start of this outbreak, there have only been 123 cases linked to transmission in workplaces. Can you also get an update on... But there's only been 123 people who've caught the virus at work. Can we get an update on how many people have caught coronavirus on a work site? To repeat a question we asked Health yesterday.
Yeah, we'll get the stats for you. Yeah, sure. But the Premier would be surprised to know is right, but I'll get the stats for you later on. Sorry. Yeah. You certainly can on the right, yes. On the right, but on the left. Yes.
A huge number of unlinked cases today, half of them. Does that mean that we can't track them? Or is it because there's all these unknown chains of transmission?
It's a bit of both. Look, I'll ask Dr. McAnulty. He works in the public health team and he could answer that question. Dr. McAnulty.
Thanks, Minister. So we have a process where we go back to cases over and over again to try and get relevant information about their chains of transmission and any links. The information we provide first thing in the morning is based on yesterday's cases, and we'll have updated information as the days progress about those links. So we're hopeful that most of them eventually get linked, but there is concern that there are unlinked cases, which mean that because it's just so transmissible, people are not aware of who they've been in contact with who have been cases. So it's just a reflection of just how infectious this virus is and why we need to take these precautions.
Mr. Doctor, the localised lockdown that we're seeing in the Central West, what are the health factors that will trigger a lockdown in a regional area? Is it the case numbers, the exposure sites? Obviously, we had half a dozen regional towns that were exposed that weren't put into lockdown.
So it's a government decision, of course, about when to put those measures in, but we look at the risk to the community in terms of has there been cases out in the community, and in the case of Orange, the person had unwittingly been in the community for much of a day or part of a day in a fairly busy shopping areas where we're concerned that there may be other people who in those areas who came in contact and led to further transmission. So that's the kind of concern we have, and given the infectiousness of the virus, we want to make sure we're getting on top of it right away.
Daniel Andrews has said, Premier, that Victoria is running alongside the virus and trying to get ahead of the virus, and he says Sydney has lost control of the virus. After these numbers today, does he have a point?
Can I say that I'll leave other premiers to comment on their own states. I'll comment on New South Wales, but I want to make this point because the issues come up around work sites. Please note the risk of the transmission at work sites is great, but what then happens is people go home and infect their household, and that is the multiplier effect. So one worker might go home and infect 5 other people, and then those 5 other people may have been to work the next day. and infected one person who then goes home and infects 5 other people. No, I understand that, but I just want to address that point because a number of people, excuse me, a number of people are asking the issue about case numbers at work sites versus households, and I'm trying to explain very clearly that this is why it's such a high risk. One person going home then infects 4 or 5 times them, and then those household members might go out the next day not knowing they've got the virus. They might go and pick up a grocery, or they might go into a workplace because they have to, and then that's how the disease keeps spreading. Now, our contact tracers are doing an unbelievable job in getting ahead of those close contacts, and that's why we've picked up so many cases, because 84,000 people came forward and got tested. But it's really critical, therefore, to stop those chains of transmission. That's why it's critical to stop workplaces coming together unless they absolutely have to. Stop households interacting with anybody outside of their household. That's why we've put in those decisions. That's why... No.
Specifically on construction sites, do you know how many cases have been transmitted on construction sites?
Yeah. Now, the important thing is, obviously, health gives us data on the workplace sites, including construction sites, where the disease has spread. But this is the other critical issue. What we do know is what we needed to do to predict future cases cropping up. So the health advice we rely on gives us advice not only on stopping the spread, but also indicating that if you continue particular actions or activity, that's going to spread it further. So that's why what the health advice does is give government great advice on the biggest risks. And that's why we take those decisions based on the greatest risk. When the health advice says to us that workplaces taking the disease home is the biggest risk, people working at multiple sites is the biggest risk, we need to accept that advice. And we need to...
What's the figure for construction sites?
We can get that for you.
Yesterday you said that the green shoots are there. Today's numbers don't seem like green shoots. Was that premature?
No, because what we do know is we have stemmed the tide of thousands and thousands of cases cropping up. We've stemmed what we call... Well, the green shoots are, we have stopped what we call exponential growth. Had we not put in the measures we had, we would have had literally thousands and thousands of cases by now. So the green shoots are that we've done incredibly well given where the virus is lurking, and I really want to thank those community members in southwestern Sydney, those community leaders who've done the hard yards, because we have stopped the rate of growth that other cities and other countries in the world have seen. The job now, all of us would love a crystal ball. I'd love a crystal ball. But what we do know based on the health advice, what we do know is the decisions we had to take to quash this and reduce the community transmission, and that's why all of us have to be patient. We need to wait till at least the weekend and early next week to see the impact of those harsher restrictions. But also, please know, in these situations we also need to think about the alternative. The alternative of not taking the action we did would have seen today's number be double, triple, quadruple what it is. That is also what we need to consider, because what today's numbers reflect is the result of the actions we've taken. Had we not taken the actions we did, those numbers today would have been double, triple, quadruple.
Given that, how can we then guarantee that construction will be going back at the end of the month if we can't see what's happening yet?
Because what we do know is the circumstances in which the virus spreads. It's human interaction, human contact, people visiting multiple sites. If and when we're confident that a workplace or a school community can safely go about their business, of course we'll take that advice and let that resume. But what we needed to do was take a pause for a fortnight in particular sectors, in particular industries, to make sure all those safety plans in place. And I know many people will say, oh, we had those safety plans in place, but not enough people were following those safety plans. Because we need to make sure that people visiting multiple sites, people coming together to do work, it only takes a lapse in concentration to have the disease spread to somebody else. And at least now we can confidently know that that pause has allowed every company, every workplace that has to conduct their business to be aware of the risks and to make sure all their workers have the attention and know the rules around that, to make sure that we follow those rules.
The Housing Industry Association has put a plan to the Treasurer on what you're saying that would reduce for residential sites, reduce mobility by at least half. Could that be accepted before July 31?
No, this pause has to be in place. Of course, we've said that to safely secure a site, to safely keep a site, as we call, warm, to make sure that they increase their or able to pick up their tools at the right time. But the 2-week pause is necessary, and I apologise for the angst it's caused people, but it's a decision we have to take. You can't argue against the health advice, you can't argue against the science, you can't argue against the facts. And it would have been irresponsible for us not to have taken that pause, as difficult as it was. It would have been absolutely irresponsible. And I know that a lot of people are feeling angst about it, but a lot of sectors have been disrupted for a year and a half because of this pandemic. Let's just think about a lot of communities, a lot of businesses, a lot of individuals have been impacted for at least a year and a half, and we appreciate and acknowledge that. But all of us have a role to play. The government wouldn't have made our decisions unless we absolutely had to. The science and the facts are there, and we need to respect that.
You're saying to the public today there is still a chance the lockdown will be lifted at the end of next month?
No, what I'm saying is that we will consider what restrictions can be eased from July 30 based on the health advice we have at that time. That's it.
So we're not getting out of lockdown.
Look, it would be, can I say that I'm sure everybody will interpret my words in 1,000 different ways, but this is the truth. We won't know what July 31 looks like across the state, across Greater Sydney, until at least the weekend and early next week. That is the fact. That is a fact. Now, anybody who wants to say anything differently, you can interpret it any which way you like. This is the fact. The fact is we won't know what July 31 looks like across New South Wales, including the regions, across Greater Sydney, until we have that information up to early next week.
Is it the case that tradies can leave Sydney to work in the regions at the moment?
Right now, there is rules in place in relation to travelling out of Sydney. If you're travelling out of those 3 local government areas of Fairfield, Canterbury, Bankstown and Liverpool, there are restrictions that you, in a class of worker, because we've got a list of class of worker, that you'll have to be tested every 3 days. From Greater Metro Sydney, if you were to leave Sydney into the regions, you would have to be tested every 7 days. But the strong advice is, unless you have to and you need to, you shouldn't. As the Premier and the Health Ministers touched on, the issue here is in relation to the spread is how transmissible Delta is. You know, the best example is that in the previous strain, if someone in the household caught it, 30% of the household caught it. In this strain, if someone in the household catches it, 100% of the household catches it. So the reality here is that we need people to do the right thing. We can put all the health orders in place, but we do need businesses and business owners, employees, to make those right decisions. And what we can do is, if things are being, loopholes are being looked to, or opportunities are there for others to travel out of Sydney to the regions, and I get more concerned about what's happening in regional New South Wales, I'll be, of course, going to the Health Minister and to the Crisis Cabinet asking for further health orders. But right now we've got sufficient orders in place and recommendations in place to stop that stemming. Sorry, I'll just continue.
Two builders from Sydney.
There seems to be a case at Coffs Harbour on a construction site, and there's your answer for construction. On a construction site where, yes, there is a firm that's working there. They've been working on this site for months. This individual, as I understand from health advice, has stayed to the Sydney stay-home orders, has remained in his accommodation, and I think we have great monitoring of that situation, but again, it's one that we'll keep an eye on. The issue around construction is around mobility. It is a significant workforce here in Sydney. I think it's about 300,000 subbies and blue-collar workers that work in the construction industry. It's not about the infection that happens on site, it's the infection that can happen during the mobility of those people, and the health advice of us to stem mobility across the state, and that's what we've done. And right across the regions. My message is for people, if you don't have to go to the regions, don't. And for those tradies, there's no point going to regional rural New South Wales looking for work when there will be a pathway for construction on July 31 here in Sydney. James?
Orange flagging. You said that for the first time New South Wales has acted hard, fast and local. Is going so quickly when there's only just been one transmission, one case, an acknowledgement and an admission that that's what the government should have done when the outbreak was in Bondi? And can I ask the same question to the Premier?
Well, if you think about that, the decision that we've made overnight for those 3 LGAs are the same stay-home orders that we put in place for Sydney after the Bondi, completely like after the Bondi outbreak, those stay-home orders. And the reality here is that, you know, I've been a member of the Crisis Committee from the outset for almost 18 months, and there is no crystal ball, as the Premier's touched on. There's no playbook or rule book. But we have learnt so much on this journey, and over the last 3.5, 4 weeks, of course, we've learnt more with the advice that we've got and the advice that we're getting from health. And for me in regional rural New South Wales, I can say honestly that I'm being very cautious, that I was quite quick to say if we need to lock down in the regions we should, because the health infrastructure in regional rural New South Wales isn't what we've got in Sydney. Yes, we can manage, but we don't want to be inundated, and that's why the decision to go into lockdown is why we've made that decision overnight.
I'll ask you the same question, why you didn't have the same cautiousness.
I think what's important to note is that during this outbreak we have allowed rural and regional New South Wales to stay open, but that is why there is a targeted approach to the Central West. So if we want to make sure that we keep our regions open, we need a targeted approach. So please know that the health advice relates to us being able to allow people to live as freely and as safely as possible, and that's why from time to time, especially in our regions, you will see a targeted response. Other states choose to do things differently, but in New South Wales we've allowed our regions to, of course there are additional restrictions they didn't have before, but that's why we have a very targeted response to the Central West in order to allow regional New South Wales to continue their activity. And please know that in New South Wales we do have targeted responses. Some parts of the state are treated differently to others, but in our view that is the best way to manage the pandemic in our state, where we can allow people to move around and have activity, because obviously in the regions that is the risk profile. We can't afford that same luxury in the Central West at this stage because of the number of exposure sites and the unknown. And this allows us to make sure that we can keep the virus out of the regions, out of spreading outside of the regions, and that is really important.
About how a regional health system like Orange will cope if cases do explode like they have here in Sydney.
Well, that's why,
and what's your strategy for looking after patients if you run out of ICU beds?
Yeah, can I say that is why the approach in the Central West is different to approaches you would take elsewhere, and that's you have to have a view on the health capacity and also the exposure sites that exist. So please know, as the health experts and the Deputy Premier has reiterated, our approach in the regions is very targeted. And I really want to thank Regional New South Wales for respecting and in fact being our biggest defenders. They're the ones that have contacted our authorities when people have been noticed around town not supposed to be there. So I really appreciate the way the regions have really stepped up. But please know the reasons why the Central West is being dealt with in the way we are is because it's a very targeted approach to allow regional New South Wales to live in relative freedom and restrictions compared obviously to what is going on. And please know, when we say Greater Metropolitan Sydney, I don't reiterate it enough, and sometimes we neglect that obviously the Central Coast and Wollongong are included in that, but we are also looking at opportunities to perhaps address those regions in Metropolitan Sydney. I don't reiterate it enough, and sometimes we neglect that obviously the Central Coast and Wollongong are included in that, but we are also looking at opportunities to perhaps address those regions in a particular way, given we can keep the virus out from particular parts of New South Wales. I'm sorry?
Could I ask you about JobKeeper? One reason it's been put forward that should return now is that so much security, if people have that kind of security with their finances, they're more likely to follow the rules. They're not getting desperate, they're not getting frightened. would you call on the federal government to reinstate it?
Oh, look, this is why we're saying to our people in New South Wales, please don't be frightened if you feel you can't go to work and therefore your family is going to suffer because you don't have an income. That's why we're saying to every individual, if you have had your hours reduced or you're worried about not having your income, please contact Services Australia. That is what the disaster payments are for. It's to help, excuse me, help people who aren't able to work or get that income. And if you're a business, please contact Services New South Wales. I'm just so grateful that within 48 hours we have literally processed thousands of business applications, and the money, and some of that money is already in their accounts 2 days later. So please know, I don't want anyone to feel so desperate that they can't respect our health orders. I don't want anyone to feel so desperate that they can't fend for themselves or their families. Quite the opposite. And if there's better ways on the ground that we can get support out more quickly, of course we will consider that. In fact, we will continue to engage with community leaders to see if there's other and better ways we can get immediate support. But please know that whether you're an individual or a business, the help and support is there. And also for those who might be having extra stress, all those support mechanisms are there. So please do not feel that this is too overwhelming. Yes, we're all going through a difficult time, but the support is there, the help is there. That's why we really fought hard. Can I thank the Treasurer in particular? We fought hard with Canberra to make sure they stepped up, and we've put in $4 billion on top of that to make sure that we keep people not only going, but also that people can plan for what life looks like once the lockdown finishes.
Do you think the federal government should be going further and giving more, a greater contribution to help people? Because a lot of people are saying they still don't have enough. Even with all the systems in place, it's still not enough to keep them going.
Look, of course we'll continue to be in ongoing conversations. If we need extra dollars from the Commonwealth, of course we'll be continuing to fight for that. But what we want is to make sure that dollars hits the pockets as soon as possible, and that's why through Services New South Wales we've seen a very quick turnaround for the thousands of applications that have gone in. We do ask people for their patience. We know that initially people were waiting around 20 minutes to half an hour to speak to somebody. That those times have gone down. We've now processed thousands and thousands of applications in the last 48 hours. And also in relation to disaster payments, obviously the federal government's in charge of those, but if we feel that the money isn't hitting the pockets quickly enough, we'll address that. Thanks, everybody. I'm sorry?
I think the penalties are quite severe, and we've shown that we will use the penalties to try and correct people's behaviour, but all along we have said this is a joint responsibility. There is no way that we can police our way out of this stupid behaviour. What we really want people to do is take responsibility for their own actions and make sure that they contribute to what is the greater good.
Later, guys. Sorry.